Good morning, Rancho. Sean Gordon here, your host, and we are doing something unique. No, I'm not going to do Beto O'Rourke and get my teeth cleaned, but I am here with Dr. Richard Ting, a noted orthodontist here in Rancho. And we're located, actually, we're back on Thomas, which is kind of behind the fire station area over by Patty, in case you're not familiar. But Dr. Ting, you are quite interesting in terms of the things that you're doing. So I wanted to take an opportunity to stop by and find out more about some of the revolutionary work that you're doing.
Thank you. You're welcome, Rehan. So what we usually do here, we are not the conventional orthodontist you usually go to see. We are called the airway and functional orthodontist. We're probably less than 5% of the population among all the orthodontists. Yeah. So what makes us unique is that conventional orthodontists, when you see an orthodontist, we all know you get braces or Invisalign. Yeah. At the same time, they'll line your teeth, give you a few rubber bands, correct some minor bite difference. That's it, you're done. Mm-hmm. So as an airway functional orthodontist, what we usually do, in addition to align your teeth, we also check the function and check your airway and make sure all the treatment that we did on you is not impinging any airway. For example, if you have any potential sinus congestion issue or snoring issue, we try our best to improve it. So later on in your life, you have less of those problems.
Because, I mean, I seem to have sort of perpetual slight bit of congestion, and I had apnea. I might still, I haven't tested, but I stopped using my CPAP machine. So that's very interesting to me, and I know a lot of guys, adult guys that have apnea issues. Yes. So you can, you don't want to say cure, right? Yes. But you can help with that?
Yes. Well, medically, nothing really is cured, okay? Right. So what we do is improve the situation. Now, according to research, people with CPAP machine have less than 40% compliance, okay? People usually drop out of it. And then the normal study shows if you have 4 hours of CPAP use every night, you're actually a good compliance patient. Oh. So what we do, and here, very unique, is that I use this device called the MSC, Maxillary Skeletal Expander. I'm actually one of the world leading practitioner on this. Really? What we do is we can actually expand your palate.
Now think, adult?
Yes, on the adult, which is used to be not possible without surgery. Yeah. Now we can actually accomplish without surgery. So imagine what's the other side of the palate, which is the sinus cavity. Yeah. So once we expand your palate, your sinus cavity, your nasal cavity, actually, the proper term nasal cavity, people call it sinus. Mm. So we can actually expand the nasal cavity and increase the volume, so you have less congestion issue.
Wow.
Okay. And also on growing kids, we have a way to make the lower jaw grow forward more instead of staying a little bit deficient. So deficient lower jaw usually cause snoring problem in adult or in kids, okay? So when you have family members have snoring issue, then that's actually a health issue, okay? Mm-hmm. Now, snoring problem could be caused by the lack of tongue space and also small jaw size, which we can improve that if you are growing kids or teenager.
Oh, wow. I actually, I don't want to get graphic, my tongue's a bit big. Mm-hmm, it overlaps my teeth and I tend to bite it a lot. Is that something you can fix?
Yes, tongue space is actually one of the important factors of the airway issue. Mm-hmm. So when we expand your arches, we increase the tongue space. So your tongue is actually naturally in a more forward position.
Wow,
which will reduce your potential snoring.
I'm going to have to come back later without the cameras.
Excellent.
Now, I see that you've actually got some really interesting devices here. You want to tell us about this a little bit?
This is a very interesting toy. This is called the iTero 3D scanner. So what we did is, remember in the old time when you see a dentist or orthodontist, you take those gooey impression material, make you gag and throw up. Yeah. So what we do is we have this now. So this actually creates a 3D print. We send it directly wirelessly through internet to the lab, and lab can fabricate a 3D model, and then we make all the appliance and retainer directly on the 3D print model. So reduce a lot of headache for patient, and it's super accurate. Okay. We also send this to Invisalign. For example, if anyone have the newer generation Invisalign, you know the impressions, the pain in the neck process. Now with this, one scan, within 5 minutes you're done, directly sent to Invisalign, without the shipping, without the delaying, so patients get the Invisalign cases back a lot sooner than the traditional method.
That's fabulous. That is really cool.
Thank you.
Well, shoot, you got a lot of really, really interesting stuff going on here. I mean, I've got kids with braces right now, and we're going to another spot over here because I didn't know you were here. But I think, if people want to find out more, they need to come and visit you here. And I don't. Is there a final thing you want to say to the folks, and then we'll go.
Excellent. Now, I think Orthodontics will always offer the complimentary consultation, which include the X-ray and the scan. Okay, and when I sit down in detail, go over the parents or the patient themselves on how we're going to treat your case, and I'll give you a reasonable treatment plan that I will provide you the reason why we're going this way versus the other way. Okay. Now, I always suggest to get multiple opinions so you know which is the best treatment plan that can fit you. Because every doctor have their own opinion.
Sure. Well, thank you very much.
Well, thank you very much.
And Rancho, this is a great spot. You parents with your your kids that need teeth work and what have you. So remember, follow us, like us, subscribe, Facebook, YouTube, BitChute, LinkedIn, Instagram, everything else. And we, of course, we want to thank our camera lady, Lisa. She does such a fabulous job.
Thank you, Lisa.
She works so hard, and one of these days we're going to have her on this side. But we'll have all the links and information for Dr. Ting here. And thank you once again for tuning in.
Thank you.
All right, there we go.
Wow, nice.
All right.